Hi guys, so this week I am doing Chapter 10, Meeting Families' Basic Needs. I have topics 2 and 3 for the week. Topic 1 is resources for informational support. The two learner objectives for this are students will be able to compare and contrast various types of parent support groups, and students will be able to identify and discuss areas of concerns for parents that may be addressed with resources for informational support. Second, I have resources for economical support, such as Social Security, Medicaid, and the professional's role in this type of information. Students will be able to describe how professionals can assist families in accessing individualized economical support. To start, there's many needs that families need met, and there's many basic needs that students require that they aren't receiving. As educators, it can be a fine line, but it's important that you address their need for support. Families who feel community support are better able to meet the needs of their child. Physical needs are obviously very important to children's learning. Examples of these would be, does the student have a coat? Does the student need school supplies? Is the student eating? Just the basic needs that you don't really think about. Finding resources is really important as an educator, because I've said this a million times, but more than likely you're probably the only person the student or the parents and the family is going to for information. So it's important to be aware of the programs out there that are being implemented to help children with that same disability or families in their same predicament, and to have information on those to be able to give to families, because you're probably the only place they're getting that information from. Again, this can be a fine line because it's not up to teachers to advise the parents on their children's needs. So it can get to be a tricky conversation if you're telling the parent what their child needs. They can be defensive. It is important, though, that you offer support and offer resources and support for the families and kind of guide them in accessing these resources. Raising a child with special needs requires a lot of additional support, and a lot of families can become overwhelmed if they don't have the support system they need. Therefore, it's important for educators to have access to various places where families can find those supports. Parents have a lot of struggles to deal with, emotionally not being able to live a normal day, really. That it can be really exhausting, and the stress and concern can seem endless. Having a special needs child can also be really isolating, so parents appreciate feeling like a part of something bigger. So it's important to make sure you're talking to them like an adult and including them in everything that you should be including them in, and even more. Some programs and parent support groups for students with disabilities are really just a Google search away, but some parents don't really take the initiative to look for those. So I'll list a couple right now. And it's important as a special education teacher or even a general education teacher to keep lists of these things and keep lists of these specific learning disabilities support groups, so they're on hand for parents if they ask for them. But there are support groups for absolutely everything, for students with dyslexia, students with language processing disorder, students with autism, students with mental health problems. There's really a plethora of information and support groups out there, so it's important to have that stuff ready for your students' parents, because you would want that if you were in their shoes. Second, resources for economical support. Families with students with disabilities may have more expenses than the typical family, which obviously if money is tight, it can be a hard situation for the whole family. Families might be forced into debt for unforeseen circumstances. For instance, losing a job, death of a loved one, death of a parent, and of course, handling a child or adult with a disability. A single parent household trying to work 1 or 2 jobs with a child with a disability is even more severe. Children affected by these circumstances are most likely to end up less educated, less involved with family, lack supervision and guidance, drop out of high school, or end up in jail. Obviously, these are just statistics, but it's important that we pay attention and try to counteract these factors because typically students are alone more in single-parent families because mom or dad's at work and therefore they're latchkey kids and they're at home more, and so it's important to not let these students fall behind or kind of slip under the rug and forget about them. It's really important, too, to be respectful of the family situation and to tread lightly when talking about these things. A lot of families can feel degraded or feel like they were treated unfairly if they have to ask for things like Social Security or Medicaid or certain financial help. And I think it's important that you make them feel comfortable and you make sure to not make them feel ill feelings or make them feel like you are judging them or being nasty at all. It's important to think about what you say before you say it because you don't want anything to be able to be misinterpreted. You're not there to judge them. You're there to help them and help their children. So it's important to provide a safe place for them to receive the resources and to kind of give them a hand and direct them in finding those resources. Economic strife is one of the hardest conditions to overcome. People feel less than average or less than anyone else because cost of living, providing food, clothing, and shelter has them strapped beyond their limits. This adds stress to the family, and the whole family could, children with disabilities, children not with disabilities, the parents, the whole family can be directly affected by financial struggle. Schools help our community by offering free and reduced lunches, healthy snack incentives, and in our local schools in North Platte, they actually offer a backpack full of food for the weekend at 4 of the low-income schools in North Platte. And what this is they fill backpacks with food that the children can easily probably fix for themselves. So not necessarily the healthiest food, but food that they don't need help fixing, just to ensure that they eat during the weekend so they can pick up their backpacks on Fridays and it gives them food for the whole weekend. The food group program, which is part of that backpack program, is they also do breakfast and lunch in the summer as well. A lot of teachers keep additional items in their classroom for snacks and for breakfast. I know that if I know that I have students not eating breakfast, I will be sure that they're being fed before we start our day. I couldn't imagine being hungry and having to try and learn something. That would be a really hard feeling, and I think it's important to remember that. In most states, if you are a Social Security beneficiary, you may be automatically eligible for Medicaid. A Social Security application is also an application for Medicaid. The Children's Health Insurance Program, or CHIP, was established in 1997 to provide new coverage opportunities for children and families with incomes too high to qualify for Medicaid but who could not afford private coverage. Medicaid and CHIP are administered by states within broad federal guidelines and jointly funded by the federal government and the states. States establish and administer, determine their own type, amount, duration, and scope of services. Federal law requires states to provide certain mandatory benefits and allows states the choice of covering other optional benefits. Mandatory benefits include services like inpatient and outpatient hospital services, physician services, laboratory and x-ray services, and some home health services. Optional benefits are, for example, prescription drugs, case management, physical therapy, and occupational therapy. So these are all, I think it's important to obtain this knowledge so you can obviously share it with the parents and share it with the families. But even knowing where to send families to get this information. And I think the most important thing is, out of this whole unit, is making sure you do your research and you are informed and you're informed enough to share your information with families, and knowing how to share that information in a way that is not rude or judgmental or nasty, because like I said, you're not there to judge them, you're there to help them. So I think that's the most important thing.